Thank you for coming today and taking the time out to visit our ICP Launch Event and listen to this presentation. My name's Ian Currier and I'm the Chief Exec at Nottingham City Council, but I'm also the ICP lead one day a week. Why did I want to do that? Well, it's not like my day job isn't busy enough. But from my time as a head teacher through to when I was the Director of Children and Adult Social Care, I can see the case to work together is strong. But as I've done work in the health arena, I can see the case to integrate is strong. Nottingham's the 10th most deprived place in the country and the 4th most deprived place to bring up your children. These are issues that get masked under a Nottinghamshire or even Greater Nottingham footprint, which is why the City Council really wanted to back a city-focused ICP. We're trying to create a common vision and set of goals, and to do that we've got a plan on the page and a small number of priorities. You can see them around the room. It's part of our philosophy, start small or build big. But as the ICP lead, I can bring all of the relevant people together and all the plans in the world together, but actually it'll be you, our workforce, that makes the difference. So thank you for coming, and as we say in the City Council, let's put the citizen in the heart in everything we do.
I'm Lynn Bacon, I'm Chief Executive of City Care. I also have a role within the Nottingham and Nottinghamshire system for people and culture, which includes Nottingham City Integrated Care Partnership. Within Nottingham City, we've already got some fantastic foundations. We've got areas of really good integrated care, we've got good trusting relationships, and we've got innovations to really wrap around and support best outcomes for local people. But we can do better than that. We know that by working together, both for shared outcomes and also working together with our people, there's so many ways in which we duplicate things. We waste opportunities to bring development, training, support for people together. And I think everybody who lives and works in Nottingham City deserve the best that we can provide. Quality of opportunities, whether that be local citizens or whether that be the people who work in Nottingham City. And this is the best opportunity that we've had for such a long time to make change and improvement sustainable for the future, that's real, it's realistic, and it's truthful to staff and local people, and it's an opportunity that we should really grasp with both hands. From people who work in Nottingham City, the ideal would be that we make things a lot easier. We often put hoops and hurdles in front of staff that prevent them from getting the very best out of their job, and things like duplication of roles, different expectations for referral and processes. And by working collaboratively through the ICP, we can break some of that down. We can make things simpler, easier, clearer. One single process for engaging with all staff, irrespective of their organisation. One process for introducing new staff into a system rather than individual organisations. Single process for development of people, where it's really clear that people get more opportunities to work in different organisations, equal opportunities for development, getting new experiences, so that when staff really understand what it feels like to work in different organisations, that starts to build understanding, that starts to build trust, and actually starts to generate new ideas for innovation and new ways of working. Because when we get really true examples of things that work for local people, it comes from those people who both live and work in local communities. And that's something that we can collectively tap into, rather than doing that as separate organisations. By bringing and pooling our resources together in a consistent and sustainable approach, it will be a lot better and a lot simpler for local people and for staff.
I'm Jane Todd, I'm a Consultant Chief Executive here at the Nottingham Council Voluntary Service. Nottingham Council Voluntary Service is 150 years old, I think now, and for all that time they've been working, improving, increasing volunteer support, voluntary sector, that they get the proper support and can really work well in Nottingham for the communities and the local community. It's really important that we're there and that we're part of it, because the sector is a very important part in the local communities but also in health, and it's great to see health being more involved in that local area and being able to see that within the ICP and working in an integrated way with social care. The main thing is this connecting, and where you get connections and connecting, then you get the trust building, and that's a really important part of what we need to be doing with health as they become more involved at that locality level, and trying to really make things different and getting the impacts that we need from the ICP.
I'm Jonathan Hard. I've been a GP in Aspley for 27 years and for the past 3 years Chairman of Nottingham City General Practice Alliance. Like most of the health service, primary care and general practice is under extreme strain. The key challenges for primary care are the huge demands on the service from citizens with chronic health conditions, especially lung and heart disease and cancer. Another challenge is around access to services and the perpetual challenge to balance on-the-day demand with planned care. I feel the ICP offers a new opportunity for a more joined-up approach to healthcare, supporting both the patient's health and social care needs. Having all the city health, social and voluntary care organisations around the table means that patient care can be developed in a truly holistic way. The City ICP will provide its citizens with a different approach to developing the services they need. Services will be less fragmented and communication between teams will improve. We aimed to work together to address not only the health issues of our citizens, but also the wider determinants of health, such as housing and lifestyle issues, that have such an impact on our citizens' lives.
We have a collective ambition to work together with our partners to improve the health and well-being of the people that live in Nottingham. We as an organisation are changing the way that we work so that we embrace the responsibility of taking responsibility for population health. It's really important that we consider the needs of our populations both now and in the future. The Hospital working with the ICPs is a great opportunity to ensure that we can identify what the needs and our future needs of our populations are, and how we can work together to ensure that our patients have the right care for their needs at the right time in the right place. So there are numerous challenges that we have across the system, and collectively we need to work together to understand those and to have a joint ambition to improve those. So we have challenges in terms of our local populations and prevention and people taking responsibility for their own lifestyles. We have challenges around how our services connect so that people don't fall through the net between our services. We have challenges, as you've probably seen today, in terms of our buildings, so investments required in ensuring that we have fit-for-purpose, state-of-the-art facilities for our patients and our communities to get the right care, high-quality care in the right environment. So collectively we need to recognise where all our individual challenges are and how we can collectively come together to have a strategy that addresses those in the short, medium and long term.
The challenges for social care are the same as they are for the health service. This is about people who are living longer, but living longer with more complex needs. And of course in an inner city area people are facing some of the pressures of poverty and deprivation. So we're really changing the way that we do social care to respond to that. We've got our new strategy and we're really focused on preventing people from needing long-term care and on working with them in their families and their communities. The ICP is a fantastic opportunity for social care. We've got lots to bring to it with our expertise, with working with citizens in their communities, and we've also got lots to gain because this is essentially about building neighbourhood teams. It's the health and social care teams that will really make sure that we can get the outcomes that we need for our citizens. And what I think is really exciting about the Nottingham City ICP is that we've started with a real understanding that people need more than just social care to help them to stay independent and maintain their well-being. We've already started working more locally in social care and we already work with our health partners, but I think the ICP will really move that leaps and bounds ahead. So I'm expecting that we're going to go local, we're going to be really connected to our neighbourhoods and we're going to be part of multidisciplinary teams. Whatever shape that takes, we're going to be working really well, really closely with clinicians, with communities, with the voluntary sector and most of all with citizens to get it right for them.
I'm Julie Hankin, I'm the Medical Director at Nottinghamshire Healthcare Trust, which is mental health and community provider, and I've been mental health lead for the integrated care system for the last 4 years. So we've done a huge piece of work over the last couple of years trying to bring together staff, different groups, service users, public, to look at that across the integrated care system. And what we're clear on is it's about making sure urgent care is there when it needs to be and people get the right care in the right place when they need it. They're not waiting for it. Getting more therapies, more access to services, and bringing together mental health and physical health. So for the Nottingham City ICP, there's going to be specific challenges about being a large urban area. We know that we've got areas that are really some of the most deprived in the country, and how do we make sure that they not only have fair access, but access that is specific to what they need, and actually focus services on there. And the aim throughout of the ICPs and the ICS has been about how do we stop inequalities in healthcare and health provision and health outcomes. So we know that people with mental health illness die 15 to 20 years earlier than they would do if that wasn't there. And that's not acceptable. So the whole focus is how do we shorten that gap? How do we make sure that the services are aimed at that and delivering that? The other particular thing for the city is obviously we have 2 very large universities, and we know from all of the building evidence that the university population students now have very particular mental health care needs and are under huge amounts of stress, and that can be really difficult to manage. So how do we support those universities? How does the ICP work with that population who are away from home, very young, undergoing a lot of stress? How do we make sure things are right for them? The integrated care partnership changes everything. Up till now we've all tried to do our little bit in our organisations, but what that's meant is, particularly as money's got tighter, things have shrunk in, and I think for staff that's felt more and more frustrating, that they see what they want to do but can't offer what they know people need, and that's a really difficult place to be in. So what the partnership does is it brings all of us together and says this isn't about what are the needs of organisations, it's about what are the needs of that individual in front of you, what are the needs of that population of the city, and how do we work together as one thing to provide it. So it's not about do I do that, is that my job, is that your budget. It's one thing, and we just focus on how do we make sure there's a seamless service to the person at the middle of it, and we end up with real patient-focused provision. We've got a really clear set of priorities for Nottingham. Part of that is linked to the national work, which sets out priorities around making sure we can meet crisis care, children and young people, making sure people aren't going out of area to beds huge distance away from their families at times when they're really unwell. But also, how do we move into prevention? How do we stop doing just crisis care and actually look at how well a whole population is? And how do you get into preventing problems before they start and have mental wellness as well as mental health services for when people are unwell? So we've looked at that as a system in Nottingham across all 3 of the new care partnerships, and so the key priorities then are urgent care pathway. We know we're an area that has particular problems with and we need to focus on. How do we bring together people's mental health and physical health? People increasingly are managing chronic illness, long-term difficulties. How do we work in a different way so you're not seeing hundreds of different people or trying to manage different pathways? And then how do we start to bring all staff able to work with people around mental health difficulties? So how do we make sure that your GP receptionist has a basic understanding and can manage things? How do we make sure that GPs, acute nurses, it's not just about when do you go and see somebody who specialises in mental health. So for me, the Integrated Care Partnership gives us a chance to really push forward on all of those priorities.
I'm Richard Holland, I'm Assistant Director of Housing at Nottingham City Homes. Nottingham City Homes manages 27,000 homes across the city on behalf of Nottingham City Council. The impact on poor quality housing on people's health has long been established. So you can see that people that live in poor quality housing have respiratory problems, mental health problems. At Nottingham City Homes we try to provide a quality house where people can go and feel part of the community and work to our vision of creating homes and places where people want to live. I think one of the major things that we've done is launch the Housing to Health service in conjunction with the Nottingham City Care Partnership and Nottingham City Council, which realised huge savings for all three organisations in the region of around about £5 million. But mainly it's had a huge impact on the individual's life by offering an individual approach to helping somebody either not going to hospital in the first place, or those people in hospital, helping them to ease a strain of moving out of hospital more quickly. What we would do is support people with their moving, with their sorting out utilities, all things that really has, big issues for an individual that is living on their own, that might be socially isolated. We're then moving them into quality social housing, whereby we can put wraparound support in there, we can offer assistive technology, and we can also give them activities that we do across the city.
Hi, I'm Hugh Porter, GP and Clinical Lead for Nottingham Integrated Care Partnership. Nottingham is a diverse city, it's a great place to live and work, and over the years we've done some really good work in the health and care sector, whether that's reducing teenage pregnancy, whether that's improving outcomes from cardiovascular disease, or doing more screening for cancer early. We've also done some wider work around the transport system or improving our schools, so we've made some real progress. And there's some stubborn and really difficult challenges that we continue to face in the city. It's the 11th most deprived area in England. We have very high levels of childhood poverty. And the healthy life expectancy between the best places and the worst places is 10 years within the city. And if we go across the boundaries into the county, it gets even larger. So these are really very substantial health challenges we need to address. So taking childhood obesity, for example, this won't just be fixed by the health system, but we need to think about teaching about healthy food to our children and families, about transport, about access to green spaces, some things which aren't just within the health system. The ICP is in a way to address the challenges of today and tomorrow. We know the NHS is changing and we need to change as a system. The ICP is that opportunity to change, and this is why we're coming together. Only by properly integrating, almost acting as one organisation, we're going to be able to start to address some of the challenges we face today and going forward. We know that frontline staff often know the solutions and answers, but historically these sometimes get lost across organisations. The ICP will stop this happening and allow staff to deliver the care and solutions that they've always aspired to.
Impactful.
Trust.
Connecting.
Opportunity.
Ambitious for Nottingham.
Transformation.
Person-centred.
Super exciting.